Okay. Welcome, everyone. Thank you so much for joining us this evening. We really appreciate everyone's interest and attention into this topic, so we're really excited to be here with you. My name is Krista. I'm going to be kind of your moderator for the evening. I just want to go over a few administrative things before I hand it off to our lovely panelists. But before we begin, we do want to take a moment and do a land acknowledgement. So the Lifemark Health Group team acknowledges that our work spans many territories and treaty areas, and we are grateful for the traditional knowledge keepers and elders who are with us today, those that have gone before us, and the youth that inspire us. We recognize the land and the benefits it provides all of us, and we invite everyone to reflect on the past and present history in their particular geographic area, and for us each to think about what we can do to work towards reconciliation. Now, before we get started, I just want to let everyone know that this is set up as a Zoom webinar, so the structure is a little bit different than a Zoom meeting. So as an attendee, you cannot turn your camera on or unmute. We do ask, if you do have a question that you would like to bring to the panelists, to please use the Q&A in the Zoom room. This just will allow us to keep everyone's questions in order and organized, as there are a large number of people who have joined us this evening, which is really exciting. We will be recording tonight's session as well, and we will be posting a recording of that along with a summary on our website, and all of you as attendees will actually get a link directly to it in your email within 1 to 2 weeks. In this format, we are not able to provide specific individualized advice or recommendations based on your particular condition. So we do ask you to try to keep your questions kind of more broad-based, not just about your particular condition. However, at the end, we will be sharing a number of ways that you can get in contact with a clinician that might be near you that can support you in your journey. And our panelists are a number of our clinicians from all across the country. They do have certain scopes of practice, so they will be bound by those as well, but they will do their very best to give you and share with you their knowledge and understanding in this amazing area. So I think that's it. Neil, I will pass it off to you and you can get us started.
Thanks, Krista, and welcome everyone. My name is Neil Pearson, and Krista, if we can go to the next slide, that'd be great. So I'm joined this evening by colleagues across Canada. So we have Tanya and Nichol in Halifax, and we have Logan Miller in Calgary, and Dan Godinho in Peterborough, Ontario. So if you're joining in with us, you're probably one of the 20% of Canadians who have chronic pain, or maybe you're here because you know somebody in your family or community who has chronic pain, and you're hoping to learn more to help support those individuals. If you have chronic pain, you've probably tried to get more active, and maybe you've even been through an exercise program prescribed by a healthcare professional. Today's presentation is really an opportunity for us to share with you things that we've learned from other people like yourselves who have chronic pain, things that they found provided more success in moving, but also for us to share some of the things that we learned from sort of up-to-date science. We want to share this information because we know it can be really difficult to become more active when there is chronic pain. Yet movement is so beneficial for our physical health, our mental health, and our social health. So science is clear, and then people in pain report that when we're able to become more active and we can get back to more of our life, that's when the added benefits of less pain start to show up a lot more. And when we look at scientific studies, they show us that there are certain things that we need to do, or things that increase our success. And we're going to talk more about that tonight. They include learning more about the science of pain, learning more techniques and practices that support us when we're working on trying to be more active, but also finding someone to guide us when we're running into those challenges that can feel like they're insurmountable. So if we can go to the next slide, back one, I think. When movement hurts, oh, isn't this interesting? All right, so well, that's the one I was looking for. When movement hurts, often it doesn't really make sense to, when we hear health professionals saying, you know, we should really exercise more, because the question you may have is, well, how am I supposed to exercise more when painful movement is my problem? And we'll address this. And the other big question that we see people having is, how am I supposed to know like how much pain is okay when I'm actually exercising or moving? And so these questions lead us to the idea that it can feel like there's some missing pieces as part of this conversation. And so if you can go to the next slide here. So figuring out how to move with more ease and to find less pain is not simple, it's not straightforward, and it's very individual. So everyone's going to be a little bit different around this. But the good news is that pain is changeable, which sometimes people have never heard that before. But we can learn how to influence pain, and we can also learn how to cope with it better. And of course, there's hope. There's hope for finding more ease of movements, and there's hope in knowing that there are lots of different options that we can use to challenge ourselves, to challenge the pain, and to challenge the amount of activity that we can do. So next slide again, please. So this is an infographic from Lifemark, and we'll make it available to everyone. It's really here to show you that you can see probably 6 check marks on there. And the point is that there's a whole bunch of different ways that we can approach movements when movement is painful. And so this infographic that we'll share only has 6 points, and there's lots more than that. But tonight we're going to focus on this one here about learning how to calm our breath, how to work on muscle tension and body tension, and also work on calming our mind while we're exercising. So we can go to the next slide. So you don't need to remember all these steps here. We're going to be going through these tonight. And Lifemark also has an online platform called First 5 Steps that you can actually go and learn more about these. But for this evening, we're going to be going through the different steps, gaining some knowledge, a breathing technique, working on body awareness, putting all that together in a calm movement challenge, and then talking a little bit about how you make this work in real life, so the planning part. And then after we talk about this, we'll have an opportunity to take questions from you, because we know that there can be so many challenges and nuances that are important to consider as you're trying these new things. So at this point, I'm going to pass it over to Tanya, who's going to take us into step 1.
Great. Thanks, Neil. So as Neil mentioned in that last slide, the first step is learning about your pain and increasing your knowledge. It has been said that the worst pain is unexplained pain and unchanging pain. So understanding pain is really important, and it's been shown to actually reduce our worry, reduce pain, and allow us to do more. Modern science tells us, and we've learned so much more over the past 20 to 30 years, that persistent pain is related to changes in the body and changes in the nervous system. So let's consider that while pain can be complex, it can be weird, it can be wonderful, and that the body is sophisticated, but we can understand it and we can influence and change it. And learning about pain is exciting. So let's look at the next slide. And talk about a few important concepts. First, the job of pain is protection. It's like our built-in alarm system, like that image there. So for example, if you think about pulling your finger back gently to the point of pain, it warns us and protects us and tells us maybe we should stop there. But if you let your finger go, the pain goes away. And this can tell us, as the second line states there, that pain is not always a reliable indication of damage or what your body can do or how much you can exercise. So think about other examples of like pain that you can experience with a paper cut or brain freeze. Those things hurt a lot, but they don't always match up with the amount of damage that actually has happened to our body. Also, pain depends on lots of things in the context, in the environment, in the situation we're in. And sometimes we can even have an injury like a bruise, or we can look down and find blood on our hand that we don't recall where it came from or how it got there. So again, pain is there to protect us and change our behavior. So as it says there, acute pain, and that's pain that usually resolves within days or weeks after an injury, is more closely related to our injured tissues. Again, its job is to protect us and promote healing within our body. However, pain that lasts longer than 3 months, or persistent or chronic pain, has more to do with changes in the body and the nervous systems. And persistent pain can overprotect us and prevent recovery, sort of get in the way. So the next slide, where do the changes that happen with persistent pain occur? These changes happen in the body tissues, the spinal cord, the brain, and the way that the body sends these alarm messages. So our nerves can adapt to send more signals. The spinal cord, when it receives them, can amplify the message, and some networks in the brain can change. Science has shown us that the areas of the brain that help to reduce the intensity of pain or turn it down become less active, and even parts that help us feel the non-pain sensations, those can become less active. Other areas of our brain can go on red alert and make the alarm system more sensitive. So as it says there, everything can become more sensitive. And I'm sure you've experienced that if you have are living with persistent pain. So in the next slide, these pictures can help us further understand some of the changes. So the graph that you see there on the left shows and sort of demonstrates what happens before you might have had persisting pain. And it shows how our built-in alarm system warns us right before tissue damage. So as you see, the alarm is right at the edge, sort of like when we were pulling our finger back. It warns us right as we're approaching damage. Whereas the graph that's going to come up on the right, there it is, shows us how the alarm has changed. It's in a different place now, and it's become more sensitive. It warns us way before tissue damage. It's further down. Maybe it occurs maybe when we start to just move our finger a little bit. But it also shows that in this picture that you see the tissue tolerance, or the ability to move our body or use our body or put load on our body, is less. And that's because perhaps we've been injured and we've been not doing as much, and our ability is reduced. But we're here to give you good news, as the last line on this slide will say. The nervous system can change and can become less sensitive, and your ability can improve. So I'm going to pass it over to our next panelist to talk about breathing.
Thanks, Tanya. So breathing is one of the really, really effective ways that when that alarm system is hypersensitive or hyperactive, breathing can help us calm back down that nervous system. If we can keep our breathing calm, it essentially teaches our body that what we're doing is safe. You can kind of think of it like fanning the smoke alarm when it goes off when you're cooking. The other thing that happens is sometimes when movement is painful, our breathing can change as well. People have a tendency to hold their breath or maybe hyperventilate, and they're breathing really quick and shallow. So to be able to move with more ease, sometimes we have to practice gaining some skill in keeping our breathing calm. And some people even get benefit from learning how to breathe calmly at rest in a comfortable position before we even try to keep our breathing calm in movements that might increase the pain. So we're going to start with that today. We're going to try a breathing technique together that I'll walk you through here. So start in a comfortable position. You can be sitting or lying down, wherever you have the most ease. And start paying some attention to the way you're breathing just naturally. See if you can pay some attention to the sensation of air moving in and out. Sometimes you can notice it at your nose or at your mouth. See if you can notice any sensations of your body moving with an inhale or with an exhale. Sometimes it's helpful to put a hand on your chest or on your belly if that's comfortable for you, to see if you can notice any of the movements of your body. Now, see if you can make your breathing a little bit longer than it was a moment ago. Ever so slightly longer on the inhale, and ever so slightly longer on the exhale than it was just a minute ago. Lengthen the inhale and lengthen the exhale. Now, keeping that ever so slightly longer breath, see if you can make your breathing smoother. Are there any places that your breath is catching? See if you can smooth out the sound of your breathing. Smooth out any movements in your body. As you're breathing in, smooth out the inhale and smooth out the exhale. See if you can even make the transition between your inhale and your exhale a little bit smoother. Now, keeping your breathing longer and smoother, add in softer. If anything feels tight or achy as you're breathing in or as you're breathing out, allow it to be a little bit softer than it was just a minute ago. Keep breathing for a moment, maintaining that longer, smoother, and softer breath. You can allow your breathing to just be natural now. So sometimes this breathing technique is one really effective way that we can recalibrate our body's nervous system and decrease the sensitivity of those alarm systems that Tanya was talking about. And gaining skill in this can go a long way in influencing pain, but it can also allow you to increase the amount of activity that you can do without the pain being provoked afterwards. So if you want to get some skill in this, you can practice this technique in a comfortable position up to 5 times a day. And you can expect improvements as early as right away. Some of you may have noticed that as we went through the practice, that maybe your pain changed as you went through the breathing. But sometimes this technique can take up to several weeks of consistent practice. But we absolutely do see change if you can maintain some consistent practice in your breathing techniques and can help you move with a little more ease. So that's one of our techniques. So I'll hand it over to Dan now to talk a little bit about body awareness.
Thanks, Logan. So body awareness is kind of another technique that we can use. You can move to the next slide, Krista. Body awareness is essentially just learning how to pay attention to the subtle non-pain sensations of your body. Very much when Tanya was talking about the alarm system of pain, with persistent pain, that alarm system becomes very loud. We sometimes like to relate it to an alarm system in a house when one that continues to go off after the burglar has left the home and there's nothing really wrong anymore. It's just constantly buzzing. It makes it very difficult in those situations to kind of pay attention to anything else, right? You could imagine if you were trying to cook while this alarm was going off, it'd almost be frustrating trying to just focus on that. So building body awareness is going to kind of helps you quiet those alarms because it starts to make you pay attention to more of these other sensations in the body that are always there, but have been overwhelmed by this pain sensation. And just like everything that's been said before, the more you practice it, the better it gets, right? So you kind of support these changes over time. And if you guys don't mind, I'll kind of get everybody to go through a little bit of a body scan with me, just so you can kind of get an idea of what we're feeling here. Okay, so bear with me for a minute, and I'll just get everyone to close your eyes and let my voice guide you. First, I want you to draw attention to your index finger on your right hand. If this is a painful area, then I want you to move to your left hand. Now think about what you can feel on that finger. Think about the temperature of the finger and determine if it's cold or warm. Then, slowly draw your attention to the middle finger. Is this finger the same temperature as your index finger? Can you determine the position of your middle finger in relation to your first finger? Is it curled more than the other? Slowly guiding your mind now down to the palm of your hand. Can you feel the temperature of the air running across the palm of your hand? Bring your attention to the texture of something that your palm may be touching. Is it cold, soft? Wrapping your attention around to the back of your hand. Do you feel any warmth there? Is there a wind that passes through the skin? And determine if this is a cool wind on the back of your hand. Then slowly drifting to your wrist on the palm side of your arm. Pay attention to anything that may be touching your wrist. A piece of clothing, piece of jewelry. What's the temperature of this? Is it metallic feeling? Now, as you continue to rest there, slowly draw your attention up your arm, traveling to the inside of your elbow. What is your elbow resting on? Is it resting at your side or on a chair armrest? What's the material that it seems to be touching? Leathery? Wooden? Cool. Can you tell how bent your elbow is as you rest there? Then we're just going to continue to travel up to your collarbone, where your shirt's probably just resting gently across. How does this material feel? Comfortable? Scratchy? Hopefully so. Now I'll just get you to kind of open your eyes and come back to this little webinar here. And hopefully, as I was guiding through that, you were able to kind of notice just different little things outside of any pain that you may be experiencing. And as you can tell, just from that quick description, there's a lot of sensations that your body's picking up at any one given time. And being able to pay attention to those really helps draw your attention away from pain and can kind of turn down the volume on the pain, so to speak. Now, how do you take advantage of this, right? This was a lot of your first times. It might have been really hard to pay attention to those little sensations, and that's totally normal, okay? Just like anything in life, it takes practice and repetition. You might have found that first time really successful. And that's fantastic. But it also can take up to 6 weeks before you start to really see the benefit of something like body awareness. But there's been lots of research to show that this has been very helpful in reducing pain. And it's something that you can definitely take advantage of. And it's very easy to do on your own. With that, I think I'll pass on my portion to back to Neil, I believe.
Oh, I think it's me actually, Dan.
Sorry.
Yes, no problem. Yeah. So great. Now let's put this all together with step 4, introducing a calm movement challenge. So as we understand that pain is not a reliable indication of damage, how do we move forward? We don't want to necessarily ignore the pain and push through, but we don't want to stop as soon as the pain increases. So I'm here to provide you a path for moving forward. And now that we've become more aware of our alarm systems, connecting with our breath like we did with Logan and our body like we did with Dan. So I encourage you to choose a movement. You can reveal the first piece. Yes, choose a movement that's gentle but might increase your pain. This is going to be individual for each person. So for example, you might choose slowly turning your head to the right, or maybe you might choose slowly bending your knee, moving your wrist, or moving your foot. You choose what works for you. Choose something that you can, it's gentle, but perhaps a challenging activity. You want to move to the edge of the increase in pain. Just nudge into it. Don't push. And when you're there, we have some questions we want you to ask. First, ask yourself, is it safe for my body to do this activity? We don't want to do movements we don't believe are safe. This can lead to the alarm becoming more sensitive. So we just want to gradually nudge into this and know that it's safe. But we also want to ask a second question. Will I be okay later? We don't want to do a movement that we'll regret or pay for later. But of course, there's more to do. So stay at the edge while you do 3 more things. Work on keeping your breath as calm as you can. Keep your body and muscle tension as low as you can. And finally, monitor the pain. Don't ignore it, but don't pay too much attention to it. Just check in on the pain. You can acknowledge it's there. So as you saw those pieces be revealed on the screen as we went through that, you can apply this process to any movement or activity. And every time you succeed with this, even a little, you're creating positive changes in your body and in your nervous systems. And it can help reduce the sensitivity of the alarm and allow you to increase what you can do over time. Remember though, pain is a moving target. So as we've said, practice is needed to succeed. Progress can be slow, and it can be difficult to work at the edge of pain and work on all these things at the same time. But be patient, and with practice, you can see changes and move with more ease over time.
Awesome. Thanks, Tanya. So we've gone through a few different strategies and kind of issued a challenge for you guys to try those out in your day-to-day life. But as we've all kind of alluded to, these do take a lot of practice. And the good news is that these are all things that you can practice at home on your own. But we have a few tips for success, the 3 Ps of success, if you will, and to kind of help you with implementing these in your life. So start by creating a plan, maybe a little bit of goal setting, and you can kind of ask yourself, what might I be doing if I had less pain? Maybe there's an activity that's really meaningful for you to get back to. And for example, maybe it's pickleball, but when you're rotating to play pickleball, maybe that right now causes some pain in your low back. So see if we can break that down into some smaller pieces. So maybe we just start with some rotation of our back while we're practicing some of these breathing techniques, our body awareness, and practicing those calm movements, checking in like Tanya was saying. We can kind of create a schedule for some of those practices. Sometimes it helps to make an appointment with yourself, put it right in your calendar, or set reminders on your computer, or put a little post-it note on your monitor at work to remind you to check in and do those exercises. Persistence. So it's something that you do have to keep coming back to. So sometimes it can be really helpful to get an accountability buddy, find a partner that you can do your exercises with, or have somebody that you know is going to check in to make sure that you've been practicing your strategies. One of my favorite ways is to kind of link your practice in to your day-to-day life. So maybe every time you're brushing your teeth, you are also practicing doing a little body scan. Where can I feel the sensations as I'm brushing my teeth? Maybe when you're stopped at a red light, that's an awesome opportunity to practice your longer, smoother, and softer breathing. I had a client once told me that her absolute favorite was when her kids started misbehaving, because when her kids was in timeout, that was everybody's chance to practice their breathing together. So that was a great implementation of some persistence and tying it into your day-to-day life. And then finally is patience. Like Tanya said, your edge or the amount of movement that you can do might be different day to day or hour to hour. And it can feel like a moving target because there's a ton of things that can affect the amount of pain that you're experiencing in a day. It can be affected by mood, sleep, movements, your nutrition, anything like that. So frustration, unfortunately, works the opposite way we want it to. So give yourself some space and understand that it is challenging for everybody. But the research is really clear that if you're able to repeat these practices consistently, you absolutely will see benefits from it. And we've talked a lot about our alarm system and pain being that alarm system for our body. So if you can practice these techniques that we've showed you today, it's a really fabulous way to kind of decrease the sensitivity of that alarm system, and it absolutely can change back. There is also more support available. So if you need any other type of help, if you want some more self-management techniques, like Neil mentioned early on, lifeisnow.ca has some more steps and some more tips for self-managing your pain. And like Krista said, we unfortunately can't give everybody very specific suggestions or treatment in our video call today, but if you are looking for some more individualized care, you can visit lifemark.ca to book an appointment with an experienced therapist like one of your lovely panelists.
Great. So I'll just ask, I'm going to change the view so that everyone will be able to see all of our panelists. And I believe, Dan, you were going to moderate through some questions that we have. We definitely see a few great ones coming in the Q&A. So I'll just pass it over to you.
Yeah, absolutely. Thank you. We have a first question here that I thought was a really good one. So if you guys don't mind, I actually might pull that one. But the question is, what is meant by the edge of pain? I'm not sure who wants to. Tanya, do you want to take it just because you were kind of talking about it?
Yeah, sure. I can take a stab at that. So the edge is where your first onset of pain. So when you feel that alarm, it might be the onset of pain. It might be, though, that sometimes you don't feel the pain at the moment. That question about, will I regret this later? Will I pay for it later? And that's a common statement that clients can mention to me is, I didn't feel it at the time. So the edge can also be defined as, if you're paying attention to some of the sensations that Dan was directing you to, when you might feel your body tighten up, if you're approaching a movement that tends to give you pain or that you have difficulty with, or if you notice that the edge might be defined by when you start to hold your breath when you're encountering something, right? So establishing that edge or that baseline can be a challenge, and it's a bit of trial and error. But noticing what you're feeling and monitoring the pain can help you find that edge. So maybe it's, if I asked if you were to go for a walk, how long do you think you can walk for? And you might say, well, I can walk for 30 minutes, but I pay for it later and I push through. I'd say that's beyond your edge or your baseline. So we might want to scale back a little bit. And I say, do I hear 10 minutes? Is 10 minutes reasonable? Yeah, but that might not seem enough. Okay, maybe 15. Yeah, that seems like that might be your edge. And your edge could probably be influenced by different things about what's going on in your life and how you're feeling that day. So it is like, we've said, a moving target. But those are some concepts around how you might think about finding your own edge for a particular movement.
I would just add on to that, Tanya, is for some of you, you may have some level of pain just at rest. So that alarm system is kind of going off in the background all day, every day. So that edge might be where you notice a slight increase in your pain, or a slight change in your breathing, or a slight change in your body tension. So it's that kind of that point where it just starts to increase beyond your normal.
And Dan, if I could throw in one other piece, it's the one of the important things to understand with the edge is that when we do get to that edge, there's always a buffer between that spot and when the body would actually be damaged. And so there are some times when we're doing activity or exercise that we want to go and nudge the edge, but other times we want to work below it. We're in that spot we might call the sweet zone, where you're not actually challenging the edge, again, because all movement is good. And we don't always have to be challenging that edge and pushing it, but there are times when that's the right thing to do.
And I was going to say one thing that I would add myself is I think that sometimes there can be a bit of nervousness about, understanding what the edge of pain is. And with taking into consideration everything we were talking about, how there's like that alarm system starts to go off much before there's any tissue damage. You can get a flare up and whatever else, but understand that you're still safe even in that, right? So there's ways to manage the flare up after the fact, and it takes a little bit of give and take, but don't be too worried about it, right? It's a learning process, and you'll kind of find your sweet zone as you continue to try. Don't give up after the first shot. Okay, so looking for another question here. Another one that looks like is a little bit consistent is, what do I do if I feel like I'm running out of breath when I'm practicing the breathing technique? And I know that even sometimes I'm guilty of that. So I might turn to Logan to help give us a good answer.
Ooh, that's you set me up for success with the good answer there. Perfect. Yeah. Do you know what? That's actually a really common, or that can be a common response, is that you kind of feel that air hunger, like you just can't quite get enough oxygen if you're paying a ton of attention to your breathing. So there's a couple things we can do. One is, if it's comfortable, see if you can sit up nice and tall while you're doing this breathing practices. See if you can pay attention to the expansion and contraction of your body. And that can allow our lungs to really increase in size as we're going through that breathing technique. Maybe it looks like focusing on just one of those cues to start with. Can we just focus on keeping our breathing a little bit softer than it was a minute ago? And really smoothing out that inhale to the exhale. And keeping in mind that you can always just return to a natural breath if it ever gets to a point where you feel like you're kind of hungry for air. You can always just come back to a natural breath and then try to re-engage with a breathing practice again.
Great. Thank you, Logan. So, sorry, just scanning through some of the other questions here. I saw another really good one that I'm going to try and volunteer you for, Neil. And it's there's a couple really just ask, if I could summarize probably the few, it's really just asking about if post-surgical pain or acute pain is the same as chronic pain.
Well, there's a bunch of different ways that we can answer a question like this. The first thing is we can say that pain is pain. Pain is always complex. It's always multifaceted. Yet there's a difference. There are differences between the more acute pain, pain that's from a surgery, pain that's from an injury, versus pain that's been a chronic pain condition. So Dan, can you say the question again? Because I want to make sure I get it right on.
Well, it's kind of a summary of a few of them, but essentially the generalized question, or there's a couple of questions that are asking if post-surgical pain is the same as chronic pain.
Right. And so I think probably the question that we're really getting at here is, would we treat it the same? So is post-surgical pain the same as chronic pain? We'd have to say no, because there's this acute or more immediate injury that's just happened. In surgery, there always would be a sort of essential trauma of the surgery, and that the surgical technique is going to change the tissue, of course, with cutting through the tissue, but also cause an inflammatory reaction. And so one of the big changes between this kind of post-surgical pain and chronic pain is that in chronic pain conditions, most of the times, there isn't this localized, intense inflammatory process happening, whereas in the acute pain, there is. Now, interestingly, that acute inflammatory reaction to all that inflammation chemistry is actually going to resolve quite quickly. And so that will make normally the pain would actually calm down relatively quickly. Whereas within chronic pain, a big part of the chronic pain has to do with the nervous system being in this protective mechanism or protective state. And so when we get to the treatment, we have to say over here with the post-surgical, we need to work on what's actually happened with that inflammation state that's going on now. Whereas in the chronic pain, we need to work on how do we change the protective mechanisms, or how do we change the sensitivity of the nervous system. And then, of course, going back to both of them, in both of them, as you calm the pain down, you also need to work on helping the tissue get stronger as well.
Yeah, and I and I think I would add too that the like one can lead into the other, right? Like sometimes you can have a surgery that becomes a chronic pain condition after the fact too. So they're very much like what Neil said, is like they're different but the same. So but I think the main point, and kind of what we've talked about in the presentation, is that pain, your body will adapt and make changes over time, right? So in acute pain, it's going to respond in one way, but as that pain has stayed there for a long time, there's going to be these changes, like Tanya was talking about, that kind of cause downstream effects that may leave the pain there for a longer period. Okay, so looking through some more questions here. I might pick on myself, because there's one here that says, what do I do if I've done too much? And seeing as Logan, Tanya, and Neil have all answered something, I should probably answer something too, even though as much as I would love not to. So if you've done too much, I think the best way to approach this is just understand. I'm assuming that in this question, what we're referring to is just you've experienced a big flare-up of your pain, right? And I like to rephrase that a little bit, because just like with the alarm system that we talk about, because you've had a flare-up of pain, it doesn't mean that you've caused damage anywhere. It just means that your alarm system is kind of going off as a protective measure, because it's kind of deemed what happened a little bit too unsafe. So the best thing to do, I would say, is just dial back your activity a little bit. So you don't want to go away and kind of start doing bed rest or just avoiding all activity or anything that you're doing. But just understanding that you may have pushed a little bit too far past that alarm, causing this flare up, and that you're safe, but you just need to moderate your activity a little bit to make what you're doing more tolerable, so that you can continue to engage in your day. In situations like this, I think it's really important that you continue to do things, because that does reinforce the idea that you've just flared up the system and that the alarm is going off, but it's not that there's anything actually wrong that's happened, if that makes sense. As long as this is assuming that you haven't had some sort of acute fall or something that caused a new injury. Anything you guys want to add on to that, feel free to dive in.
A great way to think about a flare-up sometimes is, and I can appreciate that this might seem very simplistic if you are living with persistent pain and having these flare-ups, but trying to level that out. Sometimes the way to think about it is to reframe it in your mind is like, it's like getting lemon juice or vinegar in a paper cut. It hurts like the dickens and it flares things up, but it hasn't taken away all the progress and all the healing that's happened there. We might just need to rinse that that paper cut and then pick up where we left off, right? Or sometimes when we're going along in high gear and we come to a stop sign, we don't need to pick back up in high gear. We might need to gear down a little bit and then get going again. So those are just some concepts that I like to share with respect to flare-ups or when we feel like we've done too much.
That's such a great analogy, Tanya. I was thinking a little bit different with this, is the idea that one of the things we want to recognize is if we have chronic pain, that we probably will have times when we overdo it. And so one of the things we can do is work on making a plan for what we'll do when the flare-up happens. So, it's consistent. Normally we think is that here's where we start and here's where we're going to get to, and we just go in a straight line. But usually it's like this on the way there. And so one of the things that we can do is in preparation is to create a flare-up plan and recognize that everything that Dan and Tanya have said is true, is keep moving, but then we can also do some other things, like maybe when there's a flare-up, we need to get in the bathtub and put in Epsom salts and gaze at a candle and listen to music and put on aromatherapy, do a whole bunch of things together that would actually help to calm the pain down. So anyway, having having a good flare-up plan is a really great idea as much as to have a plan for your daily pain care.
I would
Yeah,
add
actually.
in.
Oh, go ahead,
add
Logan.
in-
Sorry. Ladies first.
The Canadian standoff. Much obliged.
Yeah.
Neil mentioned a bunch of different kind of strategies, things that you can add in. And I kind of like to think of all those things to address a flare, kind of like a toolkit. And we can use a whole bunch of different strategies to address that flare up. And if you can practice the breathing and the body awareness when you're calm and at rest, once you get good at them, those are also fabulous tools that you can add into your toolkit if you do have a plan, is to tune back into your breathing and to check in with your body awareness as well.
Great. Thanks, Logan. Thanks, everybody. Okay, just scanning through a little bit more here. We have any tips for greater success with a body scan? Well, I can start that one off, given it was my question or my section of the presentation. So I think actually when I did the body scan, I kind of set it in the way I started it. I got everybody to kind of think about their index finger first on the right hand, but knowing that some people might have an injury there, I said, if that's the injured side, start on the opposite side. So I usually recommend starting on the away from the site of injury or the site of pain, just so that you can actually start to try and draw attention away from there. That's a good little starting point that I like to give out. Anybody else have anything they want to add for those?
Yeah. Once you've started, like Dan said, and you get really good at noticing any sensations away from the pain, the kind of next step or a different strategy that you can try is maybe it is your wrist that is painful. See if you can tune into any of the other sensations around the pain. Maybe you can notice the temperature, like Dan pointed out, as well as the pain. Or maybe you can notice the sensation of, your t-shirt sitting on your wrist as well. So see if there's things that you can notice underneath, around, behind the pain once you get good at it, away from that.
Great. And I guess my tip for greater success with the body scan or the breathing or even the movement challenge, I suppose we could borrow and add this to those, is practice. And I know that can seem trivial, but we've all heard that old adage that practice makes perfect. But I would challenge that and say that when it comes to the nervous system and the body, practice makes permanent. The nervous system learns, changes, and adapts what it's exposed to and what it practices. So, and the other thing to think of, there's no such thing as perfect and perfection. So give yourself some grace and keep working on that, because it does take repetition.
And if I could add just one little thing, it would be to start where you're at. So you may find that you can't stay focused on this for more than a couple minutes, or your pain may make it so you can't stay still very long. And you may say, but every time someone gives me a body scan or a body awareness, it's like 7 minutes long or something, and I just can't do it. So just do what you can at the beginning. And what you find is as you continue to do it, you'll be able to do more and more. And there are so many, one other tip I would give you is there are so many voices to listen to. And that for a lot of us, it's the right voice that's really going to draw us in and help us to stay more focused.
Awesome. Thanks, guys. We only have time for maybe one or two more questions, but there is a question that I think is a good one for us here. If anyone wants to volunteer, the question is, how do I know I'm not doing more damage? Which is a pretty loaded question, right? Like that is kind of like the question of the hour.
Absolutely. I can maybe weigh in on that, Dan, to start, if that's okay. So I think, how do I know I'm not doing more damage, or how do I know that the movement is safe? And I think it's really important, to make sure that you've had a thorough assessment by, a healthcare professional to rule out anything that's more sinister or that might need further treatment or investigation, and to help you identify what movements are safe to start with or that you're not going to harm. So to give you that guidance and confidence that you understand, and they help understand what's going on, and with that gradual exposure. But what we know is if we're moving gently, and as modern pain science has helped us understand, that the first pain we feel when we're moving is not indicative of damage, particularly when pain persists. We now have this buffer, as Neil mentioned, as long as we're moving slowly and paying attention. And that's why that gradual graded approach for the movement guidelines that we went through are helpful. But yeah, having reassurance and assessment is really important to start.
Absolutely. I think that's definitely like number one. One thing I would just add to it that I always like to try and put in the back of everyone's mind is that we have to remember that the human body is quite resilient, right? It's not a fragile piece of machinery, and it's an organic being, so it can kind of heal itself, and it's constantly changing and adapting. So that's a very important concept, because sometimes I think we get worried that if we get a muscle tear or something like that, that it's just going to stay that way forever. But we know, and based off of the research and our studies of physiology all these years, that there's lots of changes that'll happen. The body can heal many different things. So it's a much more resilient organic system than sometimes we even realize. And I think that that's all the time we have for questions today, guys. So I'll hand it back over to Krista.
Yeah. Thank you to all of our panelists for your amazing tips and tricks as well. I just want to bring up a couple of the last slides as a reminder to our attendees. There is support available to you in various different forms. So we definitely encourage you to explore what might be best for you. Again, everyone's pain is individual, and each individual is unique. So please take a look at the different options that are available to you. We also do encourage all of you to stay connected with us. So we like to do these webinars every month or two on a different topic. So if you follow us on social channels or join our newsletter group, you actually get the invites directly into your email inbox. We've also put up there on the slide a telephone number that you can call if you need some help finding a clinic that might be close to you or have a skilled clinician that you're looking for, or you can also email as well. And there's some online booking on our website. Again, thank you, Tanya, Neil, Logan, and Daniel for sharing your thoughts and your ideas with us. I know that I found it quite interesting even as a physiotherapist as well, but I know certainly based on all the great questions and comments that we've had in the chat so far, that our attendees have really appreciated you sharing your insights. So thank you again. Thank you everyone who joined us tonight, and we hope to see you again soon.